The Social Security Agency of South Africa, that's SASSA, says it has put measures in place with immediate effect to deal with the coronavirus pandemic. SASSA says beneficiaries are requested to avoid collecting their grants on the first day of payment due to the high pedestrian traffic at shopping malls and other outlets. To tell us more, we're joined on the line by SASSA CEO Busisiwe Memela-Khambula. Good to have you, Busisiwe. Thanks so much for joining us.
A very good morning and thank you.
SASSA recipients who are used to getting payments on the first of the month, what do they need to know now?
What they know now is that on the first day of the month, the focus is only going to be on the old age and people with disabilities. As we know, 70% of our customers actually bank they have cards that are SASSA SABC cards, and 30% have cards that are with the banks. In terms of transacting, usually 100,000 would normally go to the post office, and about 200,000 would go to our cash pay points. The rest of the clients normally would go to retailers and to banks.
Okay.
We had an engagement yesterday with the retailers so that we could jointly make a plan as to how are we going to manage the clients that are going to be coming to the retail shop. Mm-hmm. We are currently engaging together with the retailers to make sure that we have sufficient plans to be able to manage those clients. And each and every retail group is actually putting a plan in terms of how are we going to make sure that the distance is observed, but also to make sure that sanitation is also observed. So we have joint meetings every 2 days with the retailers so that we make sure that we are ready for payment at the end of the month. We're also engaging National Treasury to see as to whether we cannot bring the date forward and pay earlier so that our clients don't get congested together with the rest of the other people that would be getting paid on the first. So those are the continuous plans that we're working on.
Let's look at the numbers and how you plan on managing them, because obviously more than 100 people collect grants. We do know that in one specific place at the same time. We know this is now legislation, not more than 100 people can gather in the same place. How are you going to manage that?
The retailers on the retail shops all are putting plans in place to make sure that there's sufficient security so that can be observed, and to make sure that we stagger the clients as they come into the shop to make sure that there isn't more than 100 clients. There's also going to be queue marshals that are going to provide support to the clients to make sure that all the security measures are in place.
So just reiterate again in terms of how you plan on dispersing the payments come the 1st of April 2020. I know you say you're going to try and break it up and try and make it earlier if possible. But in terms of operating hours, is there a chance that they may be extended as well?
In terms of the post office, what they will do in each and every post office where the payment is going to be happening, they're going to have more than one station. So they will have a car where the transaction can take place, but also make sure that they will have transactions that are taking place in the post office. And with the retailers, what some of them have actually put in place is a situation whereby the pensioners, as they go through, they will go on a specific days. For example, Pick and Pay has dedicated Wednesday for the pensioners to be able to transact from 7 o'clock in the morning. So different retailers are setting in place different programs and schedules for us to be able to manage this. And we are going to provide support in terms of making sure that there's visibility of our staff, particularly in high-density areas, to make sure that the issues that relate to both health and security are observed.
So we've heard now that home clinic and hospital visits by SASSA officials have been suspended with immediate effect. Now, those are basically are individuals above 75 years of age and bedridden or unable to report to a SASSA office. So an application process can be completed to have a curator or a proxy apply on behalf of the affected client. So perhaps you can give us information about this. How do they obtain this form and who is going to assist them?
In terms of the procurators, the person who qualifies for the grant can what they need to do is to make sure that their documentation is sent through to our office, because our offices still work. But we can also take telephone calls to confirm that the procurator is the correct procurator, because we have call centers not only at head office but also call centers in our local offices.
Mm. In terms of, I've heard ICROP, that's the Integrated Community Registration Outreach Programs. They are also suspended with immediate effect, as most outreach programs are attended by many more than 100 people, including children and the elderly. Does this basically mean that all community projects simply stop for the moment?
What we will do is, in terms of, rather than using groups with ICROP, we're actually going to do door-to-door in areas that we've identified, and rather use pamphlets to go to those houses where we know that people need to get to understand about the facilities that we provide, rather than use groups.
Yeah. And then finally, Busisiwe, protection for your staff, because they're on the ground, they're working in direct contact with individuals. Do you have enough protection for them as well?
We actually are providing support for our staff. We had challenges, for example, on Monday and Tuesday because the supplies had not been delivered. So in some of the offices did not all open. But we now have deliveries for all the different offices we have, because we had to make sure that we use emergency procurement processes for us to make sure that they can be protected. So those that feel strongly that they want to be able to use masks, we've got the masks, we've got we've made sure that the cleaning, the facilities are cleaned properly, and we have gloves available. So all the things that we need to make sure that they are protected are available.
Thank you for talking to us here on the program. That, of course, was Social Security Agency of South Africa. That's SASSA CEO Busisiwe Memela, talking to us about SASSA beneficiaries requesting to avoid collecting their grants on the first day of payment due to restrictions put in place to stem the spread of the coronavirus. Other measures are also in place. So if you need more information, please phone SASSA on 0800 60 10 11. 0800 60 10 11. You can also phone your local SASSA office. Let's now get your news to you.